Let's look at the ghost of Kitwe Central. For decades, the story of healthcare on the Copperbelt was the story of the bottleneck. Every minor ailment in the township ended up at Kitwe Central. The result? A system so congested that the golden hour of emergency care became a 12-hour wait. In 2026, we're looking at the solution. This is Chimwemwe Level One Hospital. It's not just a building, it's a surgical strike against urban congestion. Today, we're looking at how a Level One model is saving lives by keeping the wrong patients out of the right hospitals. Welcome to the Business Indaba. Let's take an economic deep dive by looking at the cost of a queue. And we'll do that by talking about numbers, because that's what we do here. It costs the government 400% more to treat a basic infection at a tertiary hospital than at a Level One facility. Let me repeat that, 400% more. And when we say it costs the government, it means that it costs you, the taxpayer. So when we congest our specialists with primary care, we aren't just wasting time, we're burning the national budget at a rapid pace. It's sick, literally. For our business community, the waiting room is a silent tax, but that's a thing of the past. The productivity loss due to hospital queues was estimated at 1.2 billion kwacha annually. Because let's look now at the NEMA factor, because there's a Zambia-proof twist here. Chimwemwe Level 1 is NEMA accredited. Well, what does this mean? It means that it isn't just a drain on the Ministry of Health, not anymore. By billing the National Health Insurance Fund for every patient, the hospital creates a self-sustaining revenue loop. This facility is a business model that treats people and is healthy for the budget. Now let's look under the hood of this 10 out of 10 facility. Look at the inverter room. This isn't just a battery backup, it's an intelligent load-shedding sieve. When the grid drops, the system automatically prioritizes the operating theater and neonatal wing while dimming lights in the admin blocks. Then there's the oxygen autonomy. We learned from the pandemic. Chimwemwe has its own PSA, which is a pressure swing absorption oxygen plant. It generates medical grade oxygen from thin air 24/7. And then there's the maintenance service level agreement. Notice the operational excellence stickers on the equipment? These are tied to private sector SLAs. In 2026, if this solar plant fails, a local private engineering firm loses their contract. We've moved on from government maintenance to performance-based accountability. Now with the digital audit, the remote verification process. We couldn't travel to Kitwe this week, but in 2026, we don't have to be there to see there. We are performing a digital audit. The biometric sieve. We're looking at the Ministry of Health's centralized payroll. In 2021, ghost workers were a plague. Today, we pull the biometric clock-in data from Chimwemwe. As of 8 a.m. today, 94% of the allocated 200 staff members are physically on site. The data proves the boots are in the bricks. And here's the SME opportunity. Because for you entrepreneurs out there watching, look at the outsourced ecosystem. This hospital uses a hub-and-spoke model. What this means is that complex lab tests are sent to private local labs through a digital referral system. Chimwemwe is an economic anchor, a magnet for private pharmacies and medical logistics startups. So start looking into it, and maybe there's something out there for you. Chimwemwe is not an exception. It's the new standard operating procedure. It is what happens when Clean Hands from episode 35 meets Zambia-proof technology. We're building an economy where health is a right and efficiency is a requirement. Here's my Business Indaba question for you. We've shown you the data and the business ecosystem. So for our entrepreneurs, do you see the area surrounding these new Level 1 hospitals as a viable location for your next venture? Or are you still skeptical of government-led clusters? Let's debate the business of health in the comments. Next time, we look at the blue economy. We're heading to the Northern Circuit for episode 37, the Cassava Bay Master Plan. Stay healthy, stay Zambia-proof, and of course, like and subscribe and share and watch all the previous episodes before you watch the next one. See you on the next one.